We will have a very similar policy that if people choose not to be immunized and you work in healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that decision.
Dr. Bonnie Henry has gone too dang far this time, and at least some healthcare workers are ready to talk about it. Drea Humphrey here with Rebel News, and if you're living in Canada, you probably know who Dr. Bonnie Henry is. She's BC's public health officer and known for rocking $400 flu vogs she can afford thanks to her pandemic-proof paycheck, while also simultaneously shutting down indoor dining for family-run restaurants like mother of four Rebecca Matthews from Corduroy Restaurant. You may also know her because she's quite well branded, including being able to find the time to write a book during the pandemic about the pandemic, while she's paid to help British Columbians get through the pandemic. But more recently, Dr. Bonnie Henry has become all the rage, quite literally to some. She's recently dropped her Be Kind portion of her title and relied on her military expertise to try and keep healthcare professionals that don't agree with her medical opinion in line. She recently threatened unvaccinated healthcare workers. And I'm about to show you what she said to them and bring you the other side of the story to her ultimatum by letting you hear directly from 3 different healthcare professionals. But first, before I do that, I ask you to take 10 seconds of your time to stand up for your front-line workers, the nurses, the doctors in Canada who have been punished, threatened, and intimidated by their governing bodies simply for raising medical concerns or advice that hasn't yet received a political stamp of approval. You can do so by pulling out another device and opening up a tab and signing our petition at stopmedicalsilencing.com.
Yeah. So yes, we've already talked about in long-term care that people who aren't immunized will need to take additional infection prevention and control measures, including masking and in all areas where they're providing services to residents, and will need to be tested on a regular basis. And we are working through that. But first, we need to give everybody the opportunity to be immunized. That is really important in healthcare. And I have very little patience for people who aren't immunized in healthcare. And that will be, we've had a vaccinator mask policy for influenza. We will have a very similar policy that if people choose not to be immunized and you work in healthcare, then you will not be able to work in certain settings without taking additional measures. There will be consequences for that decision. Sorry, I'm losing it today.
Hey guys, I'd love to jump right into the reactions to what you just watched Dr. Bonnie Henry say, but unfortunately, you're watching this report on YouTube, and YouTube has been penalizing us for bringing viewers like yourself the other side of the story for quite some time now. So to avoid the censorship altogether, this was just a teaser. You can watch the full report at rebelnews.com. uncensored, and you can do so by opening the description below and clicking on the link we've placed there.